Hi guys, Dr. Daniel Chansha from Green Square Health here, just providing a little update about coronavirus, particularly how it relates to Sydney and the Green Square area at large. We're going to start off with a bit of a background about what's happening worldwide. So as at yesterday, the 5th of March, at 10 a.m. Central European Time, the World Health Organization released an update showing that worldwide there are 95,333 cases at present. Out of those, 80,565 are in China. So about 15% of the new cases, or total cases, are outside China now. So Chinese cases are decreasing because they've been able to employ measures that I don't think any other country, maybe other than Singapore, is going to be able to implement. And that's closure of roads, public transport, universities and schools, and telling people to really stay home with heavy penalties if they do go outside. So that's not something we're going to be able to enforce worldwide. So I think at the moment there is going to be spread of this condition. We just need to take measures to reduce its spread, reduce the likelihood you're going to get it, and make sure that if you do get it, you survive it and everything's okay. Now, still statistically speaking, the majority of people who are going to catch this are going to have very mild symptoms. The case in point, there was a couple that was infected on the Diamond Princess cruise. I think the wife had a little bit of shortness of breath and fevers. The husband didn't have any symptoms at all, and it showed that he was confirmed with the virus without experiencing any symptoms whatsoever. So there will be a range of symptoms, and the majority are going to be in the milder range. Okay. So at the moment, Australia has 66 proven cases. Unfortunately, 2 deaths from this. In perspective, that makes up about 0.00025% of the worldwide cases. And when the H1N1 swine flu took hold in 2009, we had about 37,000 confirmed cases and 190 confirmed deaths. So that was in the first year of the pandemic. And of course, every year after that, we developed immunity, we developed vaccinations, and now H1N1 is just a common circulating strain of influenza. A similar thing will probably happen with coronavirus, but it'll probably be a year to 18 months before we have a vaccine available. So right now what we want to do is mitigate the measures and reduce the chances of getting unwell. So what does this mean? It means that we're no longer relying on quarantine to be able to keep us safe. Right now we need to take measures that are going to prevent the spread of coronavirus or COVID-19 through the community. Big events such as football matches, large gatherings, protests, all those things are likely going to be cancelled. Conferences, we've seen from a lot of medical conferences are being cancelled internationally. So all these opportunities for things to spread quickly are going to be reduced. Childcare centres are likely going to start to close. If the spread sort of goes into a childcare centre, they're going to tell people not to go in. Aged care homes are going to be locked down, so visitation is going to be greatly reduced. And staff that work there are going to have to take very strict personal protection measures using gowns, gloves, masks, etc. And hopefully this reduces it through the most vulnerable and the people that are most capable to spread through the community, which is usually children. Businesses will probably get a lot of their staff to work from home if possible, particularly if they're displaying any signs of illness or if they've had any overseas travel. Which brings us to travel. So if you are planning a holiday in the coming future, it's probably advised that you don't go on that trip unless it's medically necessary or legally necessary. What about travel? So unless you have a very urgent reason that you need to travel for, it's best to delay your travel plans if possible. All the common destinations out of Australian capital cities have some evidence of coronavirus or sustained transmission in the local population, which is worse. So places like Singapore, Kuala Lumpur, Indonesia, California, going to Hong Kong, the Middle East, Abu Dhabi and Dubai, all these places that are usually transit hubs for us have been affected. So it's best to avoid or delay your trip if possible. If you booked your trip before January, you should be able to get it back on travel insurance. Otherwise, speak to your airline company, your flights and everything to sort that stuff out as well. So what can we do to mitigate the risk of catching anything? So the first things first, we want to make sure that we're washing our hands properly. Now, I've made a video and either up there or down there, there'll be a link on how to wash your hands properly. But essentially, it's covering all parts of your hands with soap and water, doing it for at least 20 seconds or 2 happy birthdays without the hip hip hooray. Dry them properly with a disposable paper towel and do that as often as you need to when you're in touch with other people, before you eat, after you visit places, after you've touched public surfaces. If you have alcohol-based wipes and rubs, these are an added bonus, but it doesn't replace hand washing. Second thing is, don't touch people. Don't shake hands. This is a very difficult thing for me to do. I'm usually shaking hands with every patient that walks in, when they come in and when they leave. Very, very important that we don't do this. Avoid it if we can. Some people are doing the foot shake or the foot tab, bring back the nod, but avoid touching hands if you can. And don't touch your face. It's such a common thing. We catch ourselves touching our face all the time. A video here of a health department spokesperson from the US talking about avoiding touching their face, and during that speech they put their finger in their mouth. So don't do it. Make a game out of it. Tell your co-workers every time they touch their face, touch their face, call them out on it. Get people to call you out on it, and every time you do it, you lose the game, you have to restart. So avoid touching your face. Masks. Now, a lot of people are still panicking about wearing masks. You don't need them. If you're not unwell, you don't need it. In fact, if you're unwell, wearing a mask may increase the likelihood of you getting sick for a couple of reasons. One, it gives a false sense of security. Two, if not worn properly, it does nothing. Three, if, for example, you are in contact with someone with COVID and you're very good and you don't touch your face or anything like that, you don't shake their hands, and it gets all over your mask, a lot of people then take their mask and sort of pull it down in order to sort of speak, have a drink, and then they put it back on. This is just now put it on your fingers and you're going to touch your face eventually. So don't wear masks. Don't buy out the stock of masks, because medical centers are running short at the moment. And if we don't have masks, we can't see people who are unwell. Because if your doctors and your nurses can't come to work, the health system is going to really suffer, and people who need to be seen are unable to be able to be seen. So don't wear masks. If you're coughing and sneezing, cough and sneeze into a tissue, definitely don't use handkerchiefs. Into your elbow, teach your kids to do that as well. Throw the tissues away immediately. So what do you do if you think you have coronavirus? Now, there's a lot of conflicting information about this. Now, you can call Health Direct and ask them for advice, but they don't know what every single medical center's policies and procedures are. So I'm going to go through ours. Ours at the moment is that if you call us or you walk into the clinic, we will ask you if you're unwell. Do you have a fever? Have you been coughing? Are you getting short of breath? If that's a yes, we ask about your travel history. And if you've been to the countries that are at risk, namely Iran, China, South Korea, Japan, Singapore, Thailand, Cambodia, Hong Kong, and look, sorry if I've missed any there. If we ask and you've been to any of those countries in the last 2 weeks, we will then offer you a telephone consultation. So we're able to have a chat to you over the phone and try help you out there. If you're already in the clinic, we'll put a mask on you and pop you into an isolation room. We're very fortunate that we do have a room free every day that we can put anyone who's infectious into, so they're not in the waiting room. Or you can wait outside the waiting room and the doctor will come and call you when we need to. And in which case we still may do a telephone consultation within the clinic. What we want to do is reduce the chance of anyone who may have coronavirus from spreading it to our patients who are the most vulnerable, okay? But we don't want people to stop going to their doctor, because it's very important. If you have any chronic diseases, diabetes, asthma, high blood pressure, heart disease, if you've had a stroke, if you're a cancer patient, transplant patient, someone with inflammatory bowel disease, any kind of joint symptoms, taking immunosuppression, asthma, anything at all, get it sorted now. There are only 66 cases. Most medical centers in Australia have had no exposure whatsoever. Go and get things sorted out while the system is not overwhelmed, because in winter, when everyone's got the flu and coronavirus, we're not going to be able to fit everyone in. It's going to take precedence of what's the most acute, and we want to reduce the risk for everybody. So see your doctor. Make an appointment if you can with your medical center. We're an appointment-only center, so this reduces the time that people spend in the waiting room. And if one of our doctors runs late, we do let people know to come in a little bit later, so they don't have to spend any extra time in the waiting room. So call your center ahead of time, let them know you're coming, let them know if you're worried about coronavirus, and we can arrange for remote testing at official accredited pathology centers, so we don't overwhelm the hospital system either. Now, if you are at risk, you've been at one of these countries, you've been in touch with someone with coronavirus, and you're feeling very unwell, you have a very severe cough, you're short of breath, we will encourage you to go to the hospital. Just call them ahead and let them know that you're suffering from these symptoms, okay? So we want to work together to make sure that everyone is safe. So in summary, what can we do? Wash your hands, wash them often. Don't use them to touch anything that you don't have to, particularly don't touch your face. Delay any unnecessary travel. See your doctor if you've got any pressing issues. Make sure all your health issues are sorted before this winter approaches. When the flu vaccine is available, make sure you get that as well. Look out for one another. I don't know if anyone's seen the movie Train to Busan or Contagion, But when things get scary, people act very selfishly, and that's completely understandable. But there are the most vulnerable in our society, people that can't get out to the shops, people that can't afford to stock up. If these people go without their supplies, they're gonna, unfortunately, they're gonna really face some health consequences for things that were completely avoidable. So you don't want to be responsible for doing that to people. Look out for your neighbors, make sure everyone's okay. Please don't overstock on things. We're not going to run out of toilet paper. We're not going to run out of paracetamol. If you need to be at home for 2 to 4 weeks, people are there to look after you. Neighbors will reach out, look after your neighbors and make sure everyone's okay. I've been Daniel Chernyshev from Green Square Health. If you're worried at all, please contact us on 9699 8111. Check out our website, gshealth.com.au. If you have any questions, put it into the comments below. I will endeavor to answer them, whether this is YouTube, Instagram, Facebook. At the end of the day, after I've seen all my patients, I'll try to get back to your questions. But come in if you need to see one of our doctors. Thanks for coming to my TED Talk. See you later.